We have created this training video using a format that contributes to enhanced and accelerated learning. However, we recognize some trainers will want to move freely throughout the video in order to better support their training schedules and processes. Therefore, the following time code markers are provided for the trainer who wishes to move forward or backward in the video to a specific training section.
In combat, warfighters suffer hundreds of traumatic pelvic injuries. These pelvic fractures are typically produced secondary to direct combat and can be blast-related, blunt injury, or penetrating injury. Left untreated, pelvic injury in the combat environment is significantly more lethal than our pelvic injuries caused by mechanisms analogous to civilian trauma. In combat, pelvic injuries require immediate attention. However, achieving pelvic stabilization can be difficult outside of a hospital environment. Combat providers need rapid access to a non-invasive, life-saving pelvic stabilization device that can be applied quickly and easily in any environment. That device is Pyng Medical's T-PODCombat. The T-PODCombat Pelvic Stabilization Device, with its patented circumferential tightening mechanism, provides the most effective means of stabilizing injuries to the pelvis while mitigating pain and reducing blood loss from pelvic injuries, which may include pelvic fractures. Capabilities. The T-PODCombat is lightweight and compact. The T-PODCombat comes packaged in a sealed, durable Mylar bag, complete with step-by-step instructions. The package is quick opening, lightweight, and easily fits in any aid bag. Efficient. The mechanical advantage pulley system can be easily closed with one hand. This makes the application of the T-PODCombat possible when only one provider is available on the battlefield. The patented pulley system uses mechanical advantage to provide simultaneous circumferential compression of the pelvis. Easy to use. The T-PODCombat can be applied under any conditions, in any environment, working in moving vehicles, in confined spaces, and under conditions of limited visibility. Rapid deployment. The adjustment mechanism, or patented pulley system, allows for pelvic stabilization in seconds. Compatible. The T-PODCombat is latex-free and is 100% radiolucent and non-metallic, making it completely X-ray, MRI, and CT scan compatible. Adjustable. The T-PODCombat's belt can be folded or cut to fit the casualty. For larger casualties, two belts can be linked together using the hook and loop surfaces. This highly adjustable system allows the responder to provide circumferential compression to the pelvis of virtually any size casualty. Before we learn the application steps, let's familiarize ourselves with the important nomenclature of the T-PODCombat so that we know how to navigate our way around the device. The T-PODCombat consists of the following components. The X-ray detection tab, or XRD tab, shown here. This is the only feature of the T-PODCombat that will be visible during X-ray, MRI, or CT scans. While the rest of the T-Pod is invisible to these forms of medical imagery, this tab allows medical professionals to know that the T-Pod is in place on the casualty. Removing a pelvic stabilization device to facilitate medical treatment or imagery can be painful and dangerous. With a T-Pod, removing the device is not necessary. The tab is hook and loop backed, so it can easily be moved to the optimal position at any time the T-Pod is in use. The T-Pod belt is light, flexible, and malleable, easily forming to the casualty's shape as it compresses around the pelvis, providing symmetric pressure. The application history label is printed with typical categories of necessary data. The provider can use permanent markers to annotate the application time and any reapplication times following the adjustments. When used, this feature ensures an accurate record of the T-Pod application timeline. The pull tab is an ergonomically designed handle, complete with finger loop that allows the provider to securely pull the adjustment cord that engages the adjustment pulley mechanism to evenly pull the belt opening and circumferentially compress the pelvis. The locking hooks, seen here, are 4 small composite hooks molded into the surface of the adjustment mechanism. These hooks are used to store and secure the 36-inch long cord of the adjustment mechanism. Properly used, they prevent accidental loss of circumferential pressure due to rapid and uncontrolled loosening of the adjustment mechanism. They are necessary to shorten the adjustment cord so that the pull tab can be safely secured to the face of the adjustment mechanism. The adjustment cord guides, seen here, bring the 2 adjustment cords together and guide them as the provider tightens the mechanism. These guides are an application reference point that you will learn in the training portion of this video. Make a mental note on their location relative to the device, as you will be asked to reference them during the application protocol. The mechanical advantage pulley system ensures a simultaneous circumferential compression of the pelvis, requiring a minimal application of force on the part of the provider. Application talk-through. Let's talk through the entire procedure to familiarize you with some of the finer points of the application. Position, placement, compression, lock and secure, and record and transport. These concepts will be explained in detail and will later directly relate to the application steps. If you are following tactical combat casualty care guidelines, the application of the T-PODCombat will occur during the tactical field care or tactical evacuation phases. If the decision is made for pelvic stabilization, your first consideration in the application protocol is position, meaning how to position yourself relative to the casualty and how the casualty will be positioned before the application begins. As always, you must follow the guidance and established protocols of your direct medical oversight. That supersedes any instruction given here. However, optimally, the casualty should be positioned supine, flat on their back. You should begin work perpendicular to the casualty, at the casualty's pelvis, and optimally, if you can, it is best to position yourself with your dominant hand superior or towards the casualty's head. Clear away any loose clothing or gear that could impede your access to the casualty's pelvic region. Understand that you are going to wrap the T-POD belt completely around the casualty's pelvis and then circumferentially compress. Therefore, do what is necessary to give yourself a clear application pathway by removing gear, excess clothing, or debris. Next, think placement. Open the Mylar package, remove the T-POD device, and immediately separate the adjustment mechanism and the belt. Place the adjustment mechanism on the casualty's chest, with the adjustment cord guide closest to you. This ensures the pull tab will be close to you, and that the action necessary to complete the compression will be pulling towards you, and not you reaching across the casualty to push the pull tab in order to tighten the device. Pick up the belt and orient it. The smooth side faces the casualty, the rough side faces out. With the belt oriented, hold one end in your dominant hand. Use the relief typically formed by the curvature of the lumbar spine on the casualty. Using your dominant hand, guide the belt under the casualty and reach across the casualty with your non-dominant hand to capture and position the belt. You want to pull the amount you visually estimate will allow you to wrap the belt around the casualty, leaving the end 3 to 4 inches short of the casualty's midline. This initial measurement allows you to bring the standing end, or the end closest to you, up and around the casualty. You trim this end of the belt, again 3 to 4 inches from the midline. When complete, you should have a 6 to 8 inch gap relative to the midline. This gap will be closed by the adjustment mechanism, and it is the closing of this gap that will provide the circumferential compression of the pelvis. The iliac crest of the casualty should be aligned with the upper superior edge of the belt. If you cannot identify this anatomical landmark, try using the casualty's greater trochanters. This reference point is typically more difficult to acquire. However, if you must use this reference point, the belt should be positioned so that the greater trochanters are aligned with the center of the belt, between the superior upper and inferior lower edges of the belt. In some cases, it may be necessary to gently roll the casualty in order to correctly position the belt. When the belt is properly positioned, check for the iliac crest and the upper edge alignment, or look for the greater trochanter alignment, and then bring the standing end of the belt up and over the casualty. Optimally, you should cut the belt with trauma shears, or if necessary, a blade, leaving the standing end 3 to 4 inches short of the casualty's midline, just as you did on the opposite end of the belt. If for some reason you cannot trim the belt, you can still complete the application by folding the standing end of the belt back under itself as shown. Holding the belt with your non-dominant hand, pick up the adjustment mechanism and position it so that the adjustment cord guides are closest to you. You will have the most control if you position the adjustment mechanism with the distal portion anchored first. Align the front edge of the adjustment pulleys with the leading edge of the belt. Holding the distal end of the adjustment mechanism in your non-dominant hand, pull the mechanism towards you and lay the mechanism on the belt. Again, the device is properly aligned when you have the front edges of the pulleys aligned with the leading, trimmed, or folded edges of the belt. If you are unhappy about the placement of the adjustment mechanism, lift it off the belt and repeat the placement steps until you have the device aligned as instructed. Double-check the hook and loop of the adjustment mechanism, applying even pressure to be certain it is securely anchored and ready for compression. Grasp the pull tab in your dominant hand and do not release it until the compression movement is completed and the adjustment cord is locked and secure. This allows you to maintain positive control of the pull tab and cord, preventing unnecessary tangles or twisting. Your next consideration is compression. Using even pressure, pull towards you with the pull tab, and observe as the adjustment pulleys close the gap and apply circumferential compression. Apply circumferential pressure until the belt is tight. The amount of pressure required to stabilize the pelvis will vary. The adjustment pulleys allow the provider to apply exactly the amount of force they deem necessary. Once the pelvis is stabilized, lock and secure the T-pod. Do this while keeping the pull tab in your dominant hand, and while maintaining constant pressure, use your non-dominant hand to guide the adjustment cord into the locking hooks. Regardless of direction, clockwise or counterclockwise, maintain pressure on the pull tab and guide the cord into the locking hooks until the pull tab is brought within 6 inches of the adjustment mechanism. Secure the pull tab to the adjustment mechanism using the hook and loop backing. Now, record the application time on the application history label. Application steps. This portion of the training video demonstrates all of the steps in sequence. Step 1. Position. Step 2. Placement. Unpack the T-PODCombat. Separate and set the components within easy reach. Position the T-POD belt by sliding the belt under the lumbar spine of the casualty. It may be necessary to gently roll the casualty to help position the belt. Adjust position of the belt relative to one of the 2 anatomical landmarks. First, use the upper iliac crest of the casualty. If for some reason this is not possible, try using the greater trochanters. The top edge of the belt must be aligned with the upper iliac crest, or the trochanters must be positioned relative to the middle of the belt. Using trauma shears, or if necessary a blade, cut the near end of the belt leaving 3 to 4 inches from the midline. Pick up the adjustment mechanism in your dominant hand to position it. Attach the far end of the belt first. Holding the belt and mechanism with your non-dominant hand, pull the mechanism toward you and lay it down on the near side belt. Step 3. Compression. Pull the pull tab toward you. When the pulley system has closed the 6 to 8 inch gap, or if you feel the pelvis has been stabilized, begin the next step. Step 4. Lock and secure the T-pod adjustment mechanism. Maintain constant pressure on the pulley system by keeping the pull tab in your dominant hand. Guide the adjustment cord into the locking hooks. Using the hook and loop backing on the pull tab, secure it to the surface of the mechanism. Record the time of the application on the application history label. Occasionally, medical providers may want to inspect the casualty's skin integrity. This will require the release of circumferential pressure to permit inspection, and the reapplication of the T-pod and the reapplication of circumferential pressure. Simply reverse the process. Using your dominant hand, grasp and lift the pull tab, and maintain pressure and positive control of the tab and the cord. Using your non-dominant hand, guide the cord as you detach from the locking hooks. Lift the adjustment mechanism on the far side, lifting and pulling the adjustment mechanism toward you. Keeping positive control of the entire mechanism, cord, and tab, set the mechanism out of the way and conduct your inspection. Set the adjustment mechanism down on top of the belt and secure the hook and loop surfaces. Now grasp the pull tab in your dominant hand and pull toward you, applying even pressure. Guide the adjustment cord into the locking hooks in a clockwise or counterclockwise direction. Secure the pull tab to the belt. Record the reapplication time on the application history label. At a minimum, circumferential compression should be released every 12 hours to check for skin integrity and provide wound care as necessary. Pyng Medical's T-PODCombat provides safe, secure, and effective stabilization treatment for pelvic injuries and possible pelvic fractures. Independent studies have confirmed the T-PODCombat's effectiveness in binding the pelvis, reducing blood loss, and lowering complications associated with the injury. Reuse of the T-PODCombat is not recommended once it has been used on an injured person due to the potential of cross-contamination. Serious injury or death may result. Why T-PODCombat? Pelvic fractures have a mortality rate of 5% to 50%, due mainly in part to the significant hemorrhage that may occur in the pelvis with minimal external signs. Achieving pelvic stabilization and reducing pain from a pelvic injury is difficult to achieve outside of a hospital environment. T-POD is a non-invasive, life-saving pelvic stabilization device that can be applied in any environment. Considerations. If an obese patient requires T-POD, 2 belts may be affixed together using one power unit as an extender and the other as a pulley. Monitor pulse and blood pressure in accordance with your organizational protocols. T-PODCombat should be replaced when soiled or after every 24 hours of use. Place Foley catheter prior to application as needed. Children under 50 pounds may be too small to obtain the 6-inch gap needed for closure.